Hello, thank you for joining us. We'll get started in just a few minutes. Please use the chat feature to tell us where you're joining from. Greetings, everyone. We'll get started in just a few minutes. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for one contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing, continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. The nurse planners and content experts in control of content today have no relevant financial relationships with ineligible companies. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, if we have time, we'll have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to our presenters. Be sure to hit send so the message makes it to us. Please use the Q&A feature for questions and the chat feature to interact with other participants. We'd like to thank our speakers for sharing their expertise with us today. Of note, thoughts and views expressed are that of the presenter and do not necessarily reflect that of Sigma. Our speakers today are Patrick Chu, Charlotte McCardle, Mercy Mumba, and Jerry Neuter. Patrick is a certified global nurse consultant specializing in policy and professional practice. He is currently completing his postdoctoral fellowship. He is the president of Mu Sigma chapter and the liaison to the United Nations for Sigma. Charlotte is a registered nurse and the Deputy Chief Nursing Officer for Patient Safety and Improvement for NHS England. Charlotte is leading policy work on same-sex accommodation, care partners for patients, and a range of safety and improvement programs. She leads the nursing profession's response to sustainable healthcare, recognizing the role nurses and midwives play to reduce climate change and making stronger links between the health of the planet and the health of the population. Women's health, specifically menopause, is a key feature in Charlotte's portfolio. As a chief nursing officer for Northern Ireland between 2013 and 2021, Charlotte has extensive experience of working in government administration, leading and shaping strategic policy for nursing and midwifery. Mercy is an award-winning scientist and philanthropist. She is an associate professor and founding director of the Center for Substance Use Research and Related Conditions in the Capstone College of Nursing at the University of Alabama. She is also a Sigma liaison to the United Nations. And Jerry is an assistant professor at the University of California, San Francisco. Jerry's research interests are in global health, specifically in maternal and child health and prevention of mother-to-child transmission of HIV. He is also interested in understanding the impact of environmental, social, and economic factors on the health of women and children, with particular concerns with HIV/AIDS in low resource countries and minority populations in the United States. Jerry is also passionate about promoting collaboration between scholars and researchers working in Africa and North America. He is the founder and Secretary General of the annual Africa Interdisciplinary Health Conference. We want to thank you all for being here, and we'll turn it over to our speakers.
Great, thanks so much, and welcome everyone for joining. As Linda mentioned, we're Patrick, Jerry, Charlotte, and Mercy. We're part of the Sigma UN Liaison team, and we're very happy to be speaking to you today about some of the work that we're doing. I'm calling from Treaty 6 territory, which is Edmonton, Alberta, Canada. And this is our agenda for today. So over the next hour, we're hoping to talk a bit about the UN system. We'll provide a bit of a historical overview of the organization. We'll talk about the role that Sigma has at the UN, and then we'll get into some key global public policy issues, as well as resources that you can take away to further engage with the UN system. So if we go into the next slide, I think it's always really nice to start off with a bit of a historical context. We've all heard about the UN, whether you like it or not. It's on the news now on the daily with some of the conflict that's happening around the world. But you might not be so familiar with the historical context in which it was founded. So the UN was founded in 1945. And after the Second World War, representatives from about 50 countries, they gathered together in San Francisco at the UN Conference on International Organization. So between April to June of 1945, they proceeded to draft and then sign the UN Charter, which essentially gave rise to this new international organization. And at that time, when they were drafting this charter, the hope was that it would prevent another world war like the one that they had just lived through. 4 months after that, after the San Francisco conference, the UN officially began in October of 1945, and it came into existence after the charter was ratified by several countries who signed the UN Charter. So since then, fast forward now in 2023, there's about 193 member states, and member states meaning countries that are part of the UN system. And it's become one of those key places where countries, civil society, the private sector come together to talk about issues and tackle issues that no one country can actually tackle alone. So some of their work includes peace and security, human rights, humanitarian aid. You might have heard a lot about sustainable development, climate action, and the list goes on and on. And if you're interested in some of the issues, we'll provide you with some links so that you can further explore on your own time at the end. If we go to the next slide, this is always a really it's a complicated diagram, and it's not meant for you to read every single thing. I know it might be a bit small, but it's just to show you how big the UN system is. On the left, you'll see the UN principal organs. So it's made up of the General Assembly, the Security Council, Economic and Social Council, which is ECOSOC for short, the Secretariat, International Court of Justice, as well as the Trusteeship Council. And within each organ, you'll see that there's a variety of different subsidiary organs, funds and programs, research and training institutes, specialized agencies, and the list goes on and on. And we like to show this because, again, it shows you just how big the system is. You'll see some of the organizations that you might be familiar with, for example, the WHO, the ILO, International Labour Organization, UNICEF, for example, within that blue shaded area. But those, are really part of that bigger UN system. If we go to the next slide, I just want to spend a few minutes talking about the key organs, just to situate where we as the UN team really has the most influence. So I mentioned in the previous slide that on the left-hand side of that diagram, there's the key organs of the UN. And the General Assembly is the main deliberative policy-making and representative organ of the UN. So all 193 member states of the UN are represented here. And each year in September, the full UN membership convenes in New York for the General Assembly, where they engage in general debate. Many heads of states, as well as civil society and members of the private sector, also attend. And Jerry, Mercy, and I were very privileged to attend this last month, and was lucky to be able to deliver 3 interventions at all 3 high-level meetings on health. So we'll talk a bit about that in the next few slides, but I think that's something to just point out in terms of raising nurses' voice and visibility within that global health sphere. The Security Council, so they are involved in maintaining international peace and security under the UN Charter. So again, you might have heard about this in the news as of recent. And the Security Council takes the lead in determining the existence of threats to peace or any acts of aggression. It also calls upon the parties to a dispute to settle it by peaceful means, and they recommend ways of adjusting terms of settlement. And in some cases, the Security Council can resort to imposing sanctions or even authorizing the use of force to maintain or restore international peace and security. ECOSOC, so this is where we are most involved in as the UN team at Sigma. ECOSOC stands for Economic and Social Council. So this is the principal body for coordination, policy review, policy dialogue, and they focus a lot of their work on economic, social, and environmental issues. They also have a role to play in terms of implementation of internationally agreed development goals. The Trustee Council, so this was actually suspended back in 1994. Previously, they provided international supervision for 11 trust territories that were placed under the administration of 7 member states. The International Court of Justice, so this is the principal judicial organ of the UN. Their role is to settle legal disputes submitted by states and to give advisory opinions on legal questions that are referred to it by authorized UN organs and specialized agencies. And then lastly, you have the Secretariat. So this is comprised of the Secretary General, as well as the thousands of international UN staff that run the day-to-day operations of this large intergovernmental organization. If we go on to the next slide, again, this is a busy diagram, but this is zeroing in on ECOSOC. And just to show you how within ECOSOC and that organ, there are, again, a variety of commissions, specialized agencies, programs, funds, entities, and other bodies. So if we advance to the next slide, there are multiple ways that civil society organizations can engage with the UN. Our primary affiliation is with ECOSOC, but there's 3 other pathways that I just wanted to mention. There's the Department of Public Information, previously known as Department of Public Information, now known as Department of Global Communications. And association with the DGC basically allows civil society to be directly involved in advocacy efforts. You can also participate in a wide range of activities and learn and network with different partners. There are certain requirements when you have some type of affiliation or accreditation with the UN entity. So if you're affiliated with DGC, there's that requirement to report on activities every 2 years to maintain that formal association. There's an organization called Conference of NGOs in Consultative Status Relationship with the UN. Short form, it's known as Congo, and it's basically a NGO of NGOs. So it's comprised of NGOs that have already some type of consultative status, affiliation, or accreditation with a UN entity. And they basically help and support those members to optimize their contributions and make sure that they are part of those policy dialogues with government and UN entities. They also do a lot of work with promoting collaboration across all of these different civil society organizations and NGOs. And lastly, there's UN Academic Impact. So this is more for you folks who are academics affiliated with academic institutions. So UN Academic Impact provides a platform as well as mechanisms for academic institutions to support some of the priorities within the UN system. So their focus is on 10 core principles, including addressing poverty, capacity building, education for all, global citizenship, access to higher education, human rights, intercultural dialogue, peace and conflict resolution, as well as sustainability and the UN Charter Resolution. So those are three additional ways in which civil society can become part of the UN or gain some type of accreditation status in addition to ECOSOC. So I'm going to turn it over to Mercy. Mercy's just going to get into some specifics in terms of what we do with ECOSOC as UN liaisons.
Thanks, Patrick, for that great overview. Again, thank you so much for being here, everybody. I'm going to help us switch gears right now. We've talked about the general overview of the United Nations and how you can participate, the different functions and governing bodies. But now I would like for us to focus our attention on how is Sigma really interacting with the UN and what types of activities and interventions are we doing in our role as Sigma liaisons. So first of all, we participate in several different events, and Patrick mentioned this just last month in September. We were at the UN General Assembly, and Patrick, myself, and Jerry were representing Sigma at the General Assembly, and we all had the opportunity to provide what's called an intervention, or, for those of you who are not familiar with this terminology, you can think about it as a speech in terms of advocating for a specific stance when it comes to a specific issue. So for example, there were 3 high-level meetings that we were a part of. The first one was universal healthcare, which Patrick delivered the intervention for universal healthcare. And then we had pandemic prevention, preparedness, and response. I was able to provide the intervention for that high-level meeting. And then Jerry attended the high-level meeting on ending tuberculosis, and he too was able to provide an intervention. And in those interventions, we really emphasized the role of nurses in making sure that whatever outcomes that we're looking at and whatever strategies or strategic plans we're going to be implementing as a United Nations should really focus on putting nurses at the core of the discussions and implementation process, because we are the largest proportion of healthcare providers worldwide, and it makes sense for our voices to be heard when we're in these high-level meetings and nursing considerations to be included as well. We also participate in health-related committees as subject matter experts. It can be anywhere from, especially with the focus on SDGs, which is the Sustainable Development Goals. We have several of those, and nurses can participate in so many. One of the things that we've done is looking at healthcare, building climate resilient healthcare organizations, which is really important. Sometimes as nurses, we don't think about the ways that we're contributing to climate change. But when you start thinking about the things that we can do within our healthcare organizations to reduce emissions, carbon emissions, regulate waste, and also promote sustainable development in terms of how are we using resources within our healthcare systems. All those things are things that nurses can actually participate in. I like to highlight one of the publications that and I think Patrick was part of that publication as well, where we talk about the A to Z's of how nurses could actually engage with sustainable development goals. And those are some of the ways that you could actually see an impact, not just on an individual level, but maybe on a chapter level and on an organizational level from a healthcare organization standpoint. The other thing that we do is to build partnerships between Sigma and other non-government organizations, academic institutions, and stakeholders. One of the things I would like to highlight is our collaboration with ICN, which is the International Council of Nurses. We do a lot of work with them. We've done work with JPIGO in the past. In fact, at this year's Commission on the Status of Women, which was in New York, we had a parallel event that was co-sponsored by ICN and Sigma. And in that webinar, in that parallel event, we actually talked about how do you bring nurses to the table in terms of digital technologies and reducing digital illiteracy among our patients, among stakeholders, and so on and so forth. So we have a lot of initiatives that we're working with other organizations as well. And then as part of the UN General Assembly, we had another parallel event that Jerry and I were able to participate in with Colgate, where we're talking about bringing oral health to the table, especially among low and middle income countries where oral health is really one of the contributors to poor outcomes, health outcomes in children. And so we have a lot of different organizations that we're working with. And one of the things I love about Sigma is if you're able to justify the partnership, they're really ready and able to support different initiatives. And so, for example, Jerry is doing some work in Africa with his conference and so on and so forth, and Sigma has been able to support that. So there's a lot of things that you can do in terms of building relationships. And if it's something that doesn't already exist, if we can provide justification for why this work is important and aligns with the mission of Sigma, then Sigma is readily able to support that. We also want to influence and advance global economic, social, and environmental issues through nursing perspectives. I think this is really important because sometimes as nurses, we tend to think of ourselves as just thinking about just from a clinical perspective in terms of clinical practice, but there's so many things that we can do from public health, population health, and even engagement with SDGs. And now I think that we're even having more conversations about policy and how nurses can be engaged in more policy and advocacy issues. So this is the best platform to do that. Next slide, please. The other thing that we want to be able to talk about is the special consultative status with the Economic and Social Council, or ECOSOC. And I think Patrick did a really good job in terms of highlighting exactly what it is that we do. So I would like to focus on how do we help to advance the UN goals and objectives. I'll talk about this in just a little bit in terms of some of the meaningful ways that you can engage, but the Sustainable Development Goals is one of the ways that maybe at a chapter level you could potentially engage in making sure that you're advancing the goals of the UN and its objectives. And also with those Sustainable Development Goals, there's also targets that you can look at, which are meaningful, measurable, tangible items that you can measure your influence and impact on. And so sometimes when people think about, Sustainable Development Goals, it sounds like it's this big issue that I cannot, maybe as an individual, touch on. But when you start looking at the different targets within the specific Sustainable Development Goals, you might get ideas on how to engage and improve, advance the mission of the UN through your engagement with the Sustainable Development Goals. We also want you to be able to conduct outreach around the world to support nurses in better understanding global priorities and the relevant work of the UN. So for example, one of the things that we do when we do our mission trips, I do mission trips to Africa with my students, is to really bring the understanding of what is clean water, how do you improve access to clean water and things like that. Even from a healthcare perspective, a lot of the healthcare organizations in third world countries don't have access to clean water. They have limited resources. How can they still be climate resilient and also be able to provide better healthcare outcomes within the context of of their resources that they have available to them. So there's a lot of different things that you can do. And another thing that in terms of helping nurses understand what UN and global priorities are, this webinar itself is one of the ways that we try to engage with nurses to bring to their attention what is it that is a priority for the United Nations, is a priority for Sigma, and how can we engage as nurses in those types of work. Next slide, please. So here's just some pictures in terms of our global engagement. On the first picture on the right, on the left side, that's me yes. Thank you, Megan. She's doing a really good job. And then we have Ken Dion, who's our president for International Board of Directors. Then we have Patrick. And then Amy. Amy is a UN youth representative, and she's just amazing. You've met Patrick, of course, he's amazing, but I wanted to highlight Amy on that picture as well. The UN youth representatives, which we don't have a youth representative as part of this conversation today, but it is another way in which you can engage with the UN, and they represent us at youth focused UN events, and she was just at the UN Youth Summit in early September as well. So they're doing a lot of great work. This was in March during the Commission on the Status of Women, and we had that parallel event with ICN. In the middle is our incredible Patrick delivering his intervention at the UN, and I'll just love to, send a shout out to Patrick for actually crafting all our interventions for the 78th UNGA. Very appreciative of that. He has a really good policy background, and we love his perspectives and just amazing work that he does. And then in the last picture, that is us at the last UN General Assembly last year. And there's Patrick, and we have Janice, who is another UN liaison. Her term ended last year, and then we have some representatives from ICN, and then myself as well. And as you can see, we try to make sure that we're not just engaging from a policy standpoint and all of this, but that we're actually building relationships with people, and it's not all work. And so we were out to dinner on this day. The next slide, please. Again, that's Patrick at the UN. That is the main UN General Assembly auditorium. This was actually last year, and so excited. This was actually during the Status on the Commission of Women. So yes, and then we have Janice and Danielle, Danielle was a previous youth liaison or youth representative. And then Janice was a UN liaison, and they were attending the 76th UN General Assembly. And also they were talking about, women's empowerment through careers in nurses and midwifery. So we're very excited to show all of these different ways in which we're able to participate as Sigma liaisons and youth representatives. And I know that this session is focused on Sigma liaisons, but as you can see, we do a lot of work with our youth representatives, and it's a lot of collaboration among the different roles. So some of the ways that you can increase awareness and knowledge among your members or chapter members is, like I said, we've developed the monthly SDG toolkit. In this toolkit, our team worked together to really highlight the different SDGs and gave practical examples of things that you can do as a chapter, as an individual, to really advance sustainable development. And then we also provide examples of what other chapters are doing in terms of the SDG toolkit, so you could get ideas. I believe that we don't have to reinvent the wheel. If something has been done already, we can learn from what other people have done and actually help ourselves do similar work or make improvements and innovations. The other thing that we do is the Virtual Mini Academy. And this is a 6-week mini academy. The curriculum is written and it's taught by UN Sigma Liaisons. And right now, Arik and Janice are teaching that virtual academy. Really great insights. Everything that I've heard from people who are participating is that they love it. It really gives them an overview of the UN, how to advocate for global policies and things of that nature. So it offers the opportunity to refine your advocacy skills through the lens of the UN and the Sustainable Development Goals, and you will receive a certificate at the end of your participation. The other thing that you can do is presentations to chapters and conferences. If you were in Abu Dhabi for the Sigma International Nursing Research Congress, you may have attended a session that Jerry and I did where we talked about the role of Sigma at the UN. We also had another special session where we talked about our results from a study that we did, which maybe some of you may have even participated in. Patrick, myself, and Janice and Sarah, who is the chief nurse officer at Sigma, were able to conduct a study where we wanted to understand the perceptions, the knowledge, and the gaps that exist when it comes to nursing and their interaction with sustainable development goals. We've actually written that manuscript, and it's right now under review, but we're going to also present those findings at the biennial convention. We have a special session, so make a date with us to come and listen to that presentation. We'll be talking about our results. Of course, we participate with the Nursing Now Challenge, and for those of you who don't know what the Nursing Now Challenge is, it's really just an initiative where we work with employers and universities and colleges to create leadership development opportunities for nurses and midwives worldwide. And Sigma was able to come on board with this Nursing Now Challenge, and now is really championing this leadership development opportunities for over 100,000 nurses that we have as Sigma members and midwives in our over 150 nations where we have members. And of course, I talked about peer-reviewed publications. We have at least 5 different, at least from the time that I've been a Sigma liaison, we've published at least 5 different peer-reviewed publications talking about different things from sustainable development goals, advocacy roles for nurses, how nurses can engage with the UN. And then we also write a lot of nursing-centered publications where we talk about different topics that are of relevance to the Sigma membership. And so now that you've heard about all of the different ways in which we engage, I would like to turn the floor or the mic to Charlotte, who's going to talk about just some specific things that she has done with her role as a Sigma UN liaison. And Charlotte, you have the mic.
Thank you, Mercy. Good afternoon, everyone. It's nice to be here with you this afternoon to share the work that we're doing as a group of UN Liaison, of which I became a member just this year. And one of my first jobs in this role was to attend the World Health Assembly 76th Congress at Geneva. And Mercy mentioned earlier that Sigma is a partner with ICN, the International Council of Nurses. So I was intending to go in the capacity to support ICN. However, a couple of weeks before the event, which takes place in May, the World Health Assembly and the UN were unable to provide enough opportunities for people because there's actually building work going on in the UN building. So they didn't have access to all of the rooms, and therefore ICN wasn't able to bring everybody that it needed. But I still went to Geneva and attended the assembly as part of my country delegation. And I don't think there would have been too much difference broadly in the information that I'd be sharing with you today, whether I went in the Sigma role or the delegation role. Most of this information is good information to know about the World Health Assembly and how it functions. So you can see the large auditorium. It's not unsimilar to the UN in New York in its layout and shape. And obviously you can see me there outside the building in Geneva. Next slide, please. So in all of these events, whether it's at the UN in New York or attending conferences or indeed at the UN in Geneva, we are all taking the opportunity to network, to raise the role that Sigma has, to talk about the work that we do, and to engage with other professionals on nursing work around the world, and to make those connections. So in the top left photograph that I am looking at is myself and my colleague Michelle Gunn, who's Australian, and her and I both completed our Global Nursing Leadership Policy programme, which is an ICN professional development programme, which Patrick was also on the same year that I did, which is where we first met in 2017, and I reconnected with Michelle at the World Health Assembly. Below that photograph, you can see that's Howard Catton, the CEO of the ICN, and Pam Cipriano, the president of ICN. So I had the opportunity to meet both of them when I was there, to talk about the work that Sigma does and to talk about some of the big issues that we have in relation to nursing across the world. And just sliding over to the middle, the bottom photograph is there with me with one of the Nursing Now representatives, which Mercy also spoke about. This Nursing Now representative is on the Nursing Now International Board, and here she's meeting the Minister for Health from England, I was part of his delegation, who was there for 3 days, where he met with other ministerial colleagues from the 52 member states in Europe and further afield, to discuss high-level meetings. In the picture directly above that, I'm with Aisha, whose second name has just left me, but she's the director of the Nursing Now campaign and the chief executive of the Burdett Foundation, which funds a lot of voluntary work and provides grants to Nursing Now to undertake their work globally. And then moving across to the top right-hand corner, I'm meeting colleagues from the Republic of Ireland. That's the chief nurse and deputy chief nurse from the Republic of Ireland. And again, talking about workforce issues that affect both Ireland and the UK, and how we work as two European WHO countries as part of the European CNO group that's been formed within the last year, which has now over 40 country members in it. And again, that's another forum where I'm bringing the work of Sigma, talking about the UN, the Sustainable Development Goals, the work I do on climate change and how I support Sigma to do that. And then in the bottom right is Dr. Amelia Tapolato, who's the chief nurse in the WHO at Geneva. And an opportunity, that's the ICN lunch event that we're at, where she is networking and meeting with nurses from all over the world. Next slide, please. So this one is Dr. Amelia launching her campaign. So she is about, I'm wanting to say a year in post, a year or thereabouts in post in Geneva. And this is her sort of first campaign, emergency care 25-25-25. And the reason that she is launching it this year and launched at the World Health Assembly is because there is a crisis in emergency care. And the evidence tells us that over 50% of global mortality has been attributed to emergency medical conditions. And the emergency disease burden is around 4.4 times higher in low-income countries than in high-income countries. So her plan is to train 25% of nurses in 25 countries by 2025 in life support emergency care training. And as part of this, she was sharing that campaign with us, but then also actively seeking supporters who could help work in lower income countries to deliver this training around the world. And subsequently, I have a meeting with her on Wednesday to think about how, in my day role, the United Kingdom can support her work. Next slide, please. So in thinking about the themes that emerged while I was there for the 4 days in May, obviously the pandemic featured highly, and what struck me was that the officials, be it government or UN or WHO or professional people, were all talking about the next pandemic. And they were talking about it not if, but when, and how we can learn from what we've all been through with COVID. And the work that nursing did during that time and the impact that's had on the workforce subsequently. But there was a major focus on antimicrobial resistance and vaccination, and the need to make sure that we take learning for this going forward into the next, if we have another pandemic. And it's interesting that the work on climate change, actually, the situation with our weather at the moment, where we're seeing several floods and very disastrous effects on people's lifestyle and living abilities, is also affecting the natural fauna and flora of our rivers and our earth. And it actually is removing natural pathogens, which has an impact on antimicrobial bacterial and what the infection control experience has shown is that antibacterials are now becoming, or bacteria are becoming, even more resistant. And so for many, the link between climate change and public health has become even stronger, and potentially wipes out a lot of work that's been done on AMR, antimicrobial resistance around the world, that got us to the point that we're at now, where we've eradicated many diseases. Many of those are starting to resurface, and many scientists believe that this is a result of climate change. So very interesting conversations around that, and also the health and workforce and the stabilization and sustainability of our health workforce. I'm in the UK, so obviously I'm part of the WHO Europe group, but the WHO Europe team have developed a framework which has been launched in Astana last week at the WHO event, and it is about looking after the health and care well-being commitments that governments can sign up to, and actions that they can take to stabilise and look after the health of their workforces post the pandemic. Obviously, at this kind of high-level meeting, be it either in the UN in New York or at Geneva, there is a lot of political representation and a lot of ministers present, as well as country ambassadors. And I noticed quite some tensions between countries at that time, particularly around the situation in Ukraine. And obviously now we have a situation in the Middle East, which I think emphasised for me the need for all of us in our roles as nurses to be politically aware and politically astute about how we manage and what we say in roles as senior nurses in regard to what's happening in the world at the moment, be it either through war or climate change or other natural disasters. The WHO priority and commitment to deliver universal health coverage and to leave no one behind was a key message that I heard. And the impact that our financial crisis and our economy and our fragile health and care workforce and the impact of the environment, the impact that all of that is having on our ability to deliver universal health coverage, and a real fear that we're not able to what Dr. Tedros said, the Secretary General of the World Health Organization, was that this required people and governments to make very difficult decisions if we're going to reach universal health coverage, and that they need to be brave and really try to focus in on that as we move forward out of the pandemic. The target for reaching the Sustainable Development Goals, which is 2030, again, was questioned about whether or not at this stage, halfway through, in terms of the cycle for meeting those goals, whether or not it is achievable. And again, I think that references the pandemic, world crisis and financial difficulties in terms of our ability to meet those. And the message from that was really, if we're to meet those Sustainable Development Goals by 2030, every country in the world needs to put their shoulder to the wheel and really prioritise it from now on. And then there was a major theme around women and girls in healthcare, around equity and education and trafficking and violence, a very disturbing picture around that, and I'll come back to that in a second. And a key focus, as I've said, on climate change. So next slide, please, Megan. So some takeaway messages for me were in two areas of interest. One was around women and girls, and my interest in that is because I lead women's health in my day job for the NHS, but also we work in a predominantly female profession, and we know that there's health inequalities right around the world, and the impact of situations like war have a bigger impact on women and girls than anybody else. So the UNICEF, the head of UNICEF spoke, and she said that women face inequity in the workforce and are paid 24% less than men around the world. Now that will vary from country to country, but that's an average. And she said that UNICEF are supporting skills, education and apprenticeships for girls to elevate community health, but more needed is needed to be done if they're going to meet the Sustainable Development Goals. And she said, time to act, which was the hashtag from the conference itself. And in relation to the climate crisis, Dr. Tedros himself said in his opening speech highlighted the challenges that we need to face urgently if we want to live healthy lives, reach universal health coverage, and live with a healthy planet. He, in his celebratory remarks of the WHO 75th anniversary and the World Health Assembly 76th Assembly, said that this was the biggest crisis to face health as we move forward. So there was a lot to learn from being at the World Health Assembly. There was a lot of opportunities for me to influence and to talk about the role of nursing, which I did. And hopefully I will get the opportunity to go next year as a Sigma UN liaison and have the opportunity to make an intervention on behalf of ICN. So I'm going to hand over now to Jerry.
Wow. Thank you, Charlotte, Mercy, and Patrick. I have the difficult task now making sure that I finish in time so we can also have time for questions. So here we go. And I'm the water guy. And out of, we know we have 18 SDGs. And then SDG 6 talk about clean water and sanitation. And when we have presentation like this, because we're focusing on the SDGs, we want to bring at least one or two of the SDGs to our participants who understand what we are doing, what we can do as nurses in general in helping advance the targets in meeting the SDGs by the 2030. So we know one of the crises that we face currently is water and sanitation. And worldwide, over 2 billion people still lack access to water. You may wake up from a part of the world this morning or this afternoon, you didn't have problem accessing water to maybe take shower, cook or anything, but somebody this morning spent more than 6 hours in search of a gallon or 2 or 3 of water just to take care of themselves. And globally, more than half of the global population do not have access to safe sanitation, and this actually is around majority is in the low and middle income countries. And a lot of people in the world practice open defecation, and we know as nurses, as healthcare providers, we know this actually leads to a lot of problems. So as we hear some of these things, we are thinking about how can we as nurses also do our part in helping solve some of these problems. Let's go to the next slide, please. And this is just giving us the map. When we talk about the figure, sometimes without pictorial view, some people love pictures, and looking at it in this graphic will help understand. So when you see the world divided into half, the north, the global north, and the global south, and we look at the gap around the global north and global south, we see a huge difference around access to water. And if you look at the first one, global access to drinking water, you see the majority around the global south are struggling in terms of access to water. And the same way, you look at the other side, which is the sanitation, where you have the yellow and the colors are not very green. You see where that's where we have issues with access to sanitation. And the main issue, and I think Charlotte touch on the gender and other things that we have to tackle as we work on this. There's a wide gender gap actually when we look at access to water and sanitation, and also depending on also how we use water and how we need these sanitation facilities and water facilities. There's this wide gap, and mostly in low and middle income countries. And we know because of the gender role, female are burdened most of the time to look for water for domestic use, and these actually keep most of them away from home, and also keep them away from school and other things that they need to do to advance their career or to actually safeguard their future, as well as sanitation, menstrual practice, menstrual hygiene related issues in young girls in low and middle income countries, leading to a lot of communicable diseases. So why are we saying this at all? We as nurses, we think that this is very important for us to tackle, and because it's all linked to several diseases, several communicable diseases that we see in our hospital or in our practice every day. Let's go to the next slide, please. So water is a gift, and we know water is essential in every part that we need, whether we're talking about food, or we're talking about sanitation, however, structural factors. Among the problems that are actually worsening the water crisis, there are top 4 of them. One is overuse. While some parts of the world are struggling to use water, to have access to water, in other parts, we are using them. So maybe if you wake up this morning, you're in a shower for a long time, you have contributed to some of that problem. And then there is water pollution happening all over, where some countries, or the industrial countries, sometimes go dump some of their industrial waste around the water. In low-income countries, these are also happening. And we also have infrastructure problems, as well as climate change, which is also changing the pattern of rainfall and others, sometimes leading to flood or droughts. And over the past centuries, we know that poor sanitation claim a lot of lives globally. Let's move to the next slide, please. So I just want to, because of time, I was going to ask you to share but let's do this. How many times as a nurse, how many times do you wash your hand? If you can put that in the chat, do you wash your hand when you at work? An average time you wash your hand as a nurse in your hospital practice? If you can put that in the chat, 3, 4, 5, 10, or whatever, how many times you wash your hands in a hospital. Wow, somebody say 10 or more times. 10, yeah, 2 minutes to count. Yes. So that's absolutely. So that is how water is very important. Several times that most of us cannot count. That's how much we use water. But it is striking to know that there are health centers currently do not have access to water for a long period of time, because the water supply to the health facility is blocked, is not working within a period because there is lack of water. And this happened mostly in low and middle income countries. And you working in a healthcare facility, just imagine going through that, where you don't have access to water flowing. Sometimes people have, infrastructure-wise, people have to use something to fetch the water to wash their hand and then put it back. And we see how all these things affect the work of nurses in a healthcare facility. And I know I was going to also ask this, the hand sanitizers are helpful, but we can't use all of them. We can't use that all the time, and therefore water is very important. So let's go to the next slide and see how can nurses contribute. Education is very important in our part of the world, and we have to conserve water. We have to also have water, sanitation, hygiene, and healthcare. Very important that we have to look at and see how we can be able to promote this. And also, we do the waste management in a way that decrease the use of water, and also advocate. And as nurses, we also have to do health assessment around water access, water availability in patient home, how that can impact their healthcare. Also, it can impact their health outcome. Next slide, please. So I finished with that, and I want us to, because we need time for at least one or two questions, I want to share, I think my colleagues have shared a lot, talk a lot about the resources, and this slide is going to be shared also with everybody in a PDF format. You can have some of the resources that can help you get more familiarized with yourself with the UN and the role at the United Nations. And I also want to I always say this, if you ever find yourself in New York, you can plan a tour for UN briefing by UN official in the UN headquarters. It's very important. You can do that and know what they do. They'll take you time to share a lot of information that maybe we are not able to capture in our short presentation today. You can learn more about that if you have the opportunity to go there. And please sign up for our mailing list, a Sigma. Though I see some people say they are not yet members of Sigma, I encourage you to join. And also we have the good thing is that we have the Liaison application and youth rep application open until November 1st. We want to encourage you to apply if you're interested in joining us. Somebody also asked how many years or how long is the term? It's 3 years. And then you get up application. I don't know if there is a link to the application site for anyone who might be interested in applying for this UN Sigma role, a liaison role, or the youth representative role. So I want to end it here, and then we can take other questions before everybody begin to drop off. Thank you for your attention.
Thank you all for sharing this great information. Let's sneak in a couple questions here. This one is specifically directed to Patrick, but I think any of you could answer. In Brazil, there is a big problem regarding human rights, in particular patient rights. How can the UN help with that? What do you think?
Yeah, thanks for that question. It's a big one, and not sure I can, speak on behalf of the whole UN system, but one quick thing that comes to mind just in terms of the entity that's most appropriate is the Office of the High Commissioner for Human Rights within the system, and they work very closely. Of course, it's guided by the UN Declaration of Human Rights, and they work with governments to fulfill their human rights obligations. They can speak out objectively on human rights violations, and they also provide a really good forum for civil society and other partners to work together to fulfill human rights obligations. So I think there's human rights embedded in all aspects of the UN system. I think in terms of our role as liaisons, one way might be to connect with us and to see whether there's opportunities for us to influence, whether it's through oral statements, written statements, or with conversations when we meet with our partners. But yeah, big question. I think there's multiple ways that we as nurses can influence, certainly. And I'll let others chime in.
Okay, so moving on, this is another question that's it's a big question, and it's related to chronic kidney disease. This individual is from South Africa and is wondering how we can get chronic kidney disease as on the radar for global priorities. What does this group think about that?
Yeah, I'll attempt answering that. If you look at the goal 3, it's health and well-being, and this, if you look at the sub goals and or targets under that, it focuses on also the chronic diseases that we can focus on. So the UN, when you look at the goal, that if the 18 goals, they are like big, but when you go and look at the document, they have targets, focusing on some of in all these areas. So absolutely, the UN or the SDGs are actually focusing on the chronic diseases as well as in the targets that they are hoping, or we are hoping to achieve by 2030.
Wonderful. Thank you so much, Jerry. Unfortunately, we are running out of time, so there are still several questions that we are not going to be able to get to today. So please feel free to email global@sigmanursing.org if you want to continue this conversation. Megan, could you go 2 slides forward, please? We want to thank everyone for attending this webinar today. And we, of course, want to thank our presenters for sharing all of this great information with us. We hoped you enjoyed this webinar. As a reminder, about 1 week from today, you will receive an email with the link and instructions on how to obtain your nursing continuing professional development certificate. And we encourage you to please check out Sigma's upcoming webinars to support you and your colleagues at sigmanursing.org. Thank you so much for joining us and have a wonderful day.
Thank you.
Thanks, everyone.